And if NABH makes MD pharmacology mandatory for clinical pharmacologist role, sorry to say this clinical pharmacist, you have no role in Indian hospitals. Hello guys, I was going through this article, role of clinical pharmacologist in Indian accredited hospital from Department of Pharmacology, that is MD pharmacology. Before coming to point, I'll tell you what NABH accreditation is. It is a certification mark for hospitals which they will get if they adopt safe medication practice as part of management of medication in hospital. While mentioning about the role of clinical pharmacologist, author told that he strongly believes that a doctor with specialization in MD pharmacology are the best candidate to implement the NABH medication management standards because many of these standards requires dedicated and exhaustive training of medical pharmacology domain along with extensive hands-on patient handling experience, which I agree. But he also told that PharmD lack above expertise due to their less patient-centric curriculum, which I do not agree. Author may not have complete awareness about PharmD curriculum. Here I am not making this video to prove who is more suitable. The matter of concern is, firstly, concept of NABH started in 2005. Now we are in 2026. The term NABH or NABH guidelines are nowhere mentioned in PharmD curriculum. In 90% of pharmacy colleges, pharmacy practice faculties are not training students in these aspects and expect them to work as clinical pharmacologists post-graduation. NABH guidelines does not clearly mention the qualifications for clinical pharmacologist or drug safety officer role like PharmD or MD pharmacology. If PCI fails to establish clinical pharmacist role lawfully in Indian healthcare, and if NABH makes MD pharmacology mandatory for clinical pharmacologist role, sorry to say this clinical pharmacist, you have no role in Indian hospitals.